my fellow Americans. Tonight, I want to speak with you about our nation's unprecedented response to the coronavirus outbreak that started in China and is now spreading throughout the world. Today, the World Health Organization officially announced that this is a global pandemic. We have been in frequent contact with our allies, and we are marshaling the full power of the federal government and the private sector to protect the American people.
Well, 5 years later, we're looking back on lessons learned from the outbreak and the impact it's had on all of us. Joining us now is Dr. Bob Lahita. He's the director of the Institute for Autoimmune and Rheumatic Disease at St. Joseph's Health. And Doctor, you were a key part of informing our viewers back then and for many weeks and months about what to do. So I'm just curious how you're reflecting on where we are now, considering what we went through then.
Well, Errol, we're in a much better place now. We still have people getting infected with COVID, and right now they're buying and we're testing in emergency rooms and in clinics for the flu versus COVID. And we have many, many variants later from 5 years ago when it was a very scary time. I mean, the Delta variant was, you may remember, the initial variant of the virus that caused incredible numbers of people to die. And I can reflect on that in great detail. But I would say that over the 5 years, we've come a long way. New medications to treat acute COVID, more information and logic about the use of masks and about isolation and safe distancing. So it's a new time, it's a better time, and we're all very grateful for it.
Yeah, I remember we had the Delta variant, the Omicron variant. It disrupted travel, and we had a missed flu season for a year because so many people were vaccinated. And on that point, what have we all learned about vaccines and the communication of vaccines? And where do you see that headed?
Well, that's a very interesting question, Errol, because I still hear from patients that I'm afraid to take the vaccine. I'm afraid to take the booster. I've heard of so many side effects. You know, there are rumors out there, and social media has done nothing but spread these rumors. And a lot of patients are frightened. But our advice is, first, before we talk about the nature of the vaccine, if you are an elderly individual over age 65, say, if you have diabetes, if you're obese, you should take a booster. Now, you can take the booster at the same time you take the flu vaccine, which we advise everybody to get every year. And right now, the flu is going around and causing major problems for some people. Now, let's talk about the vaccine. The vaccine, you remember, there were all sorts of braggings about warp speed development of messenger RNA, a whole new concept of vaccination. The messenger RNA was novel, it was quick, and it did its job. It protected us. There was a time, Errol, when I thought every day I was going to die. I was dressed up in personal protective equipment. We couldn't have enough of it: double gloves, Tyvek suits, masks, shields, head coverings, and special shoes. You can imagine. And we fought over this equipment because we thought we were next. With the numbers of patients that I was pronouncing dead on a daily basis, it was an incredible situation. And you remember, you mentioned the refrigerated trucks. And the refrigerated trucks were a natural byproduct of new intensive care units, which we set up everywhere: the emergency room, pediatrics, obstetrics and gynecology. It was a chaotic time. And those vaccines came along and saved thousands, if not millions, of lives. Now, Errol, everybody's immune system is different. So we know that certain people are going to get infected differently and succumb to the disease differently, and other people are going to get the vaccines and have reactions. Fortunately, these reactions are very rare, but they do occur. And we saw them, and we still see them.
Dr. Lahita, it's not lost on me that you and so many other healthcare professionals risked your lives to keep us safe. My emphatic thanks to you and your entire industry. I've gained a deeper respect. My grandmother was a nurse, but I've gained a deeper respect for you all since then. We are out of time, but thank you so much for all that you do.